Today we will be talking about something related to ulcer. That is an important contribution given by Dr. Baron James Marshall with respect to ulcer. He has risked his own life in giving this concept. So let's see what he has done. Let's get into the video. So before we get into the discussion, that is to know exactly what was Dr. Marshall's contribution with respect to ulcer, we need to know what ulcer is. Ulcer is a common term that we keep hearing from our friends or from our relatives in the society, or we ourselves would have got ulcer in some period of our life. So before we get to know what ulcer is, we have to know that we have got something called as a digestive tract, a tract in which digestion takes place, which starts from mouth and ends with anus. In the digestive tract, there is an important organ for digestion which we call the stomach. Everyone knows this. Stomach secretes gastric juices which has got various enzymes along with hydrochloric acid, and hydrochloric acid is going to help the enzymes to perform digestion. Then what is ulcer? Friends, whenever there is an elevated level of hydrochloric acid for a prolonged period of time, it is going to attack the inner wall of the stomach, which we call as an ulcer, right? What exactly elevates the HCl level is the question. So it could be various reasons, friends, a psychological stress which we normally are subjected to, or it could be stimulants which are known to increase the HCl secretion, or the HCl enzyme mix is going to act on protein that we normally consume in our food. So when we don't take food in an appropriate time, so all this ulceration, everything can happen. We are giving a chance to our acid to attack on our own walls of the stomach, right? And normally the treatment that is given, now we have got various lines of drugs and various lines of treatment that is available, and initially we doctors, physicians recommend antacids, the one group of drugs which are against acids, which is normally
magnesium hydroxide.
We have got commercially available antacids such as Gelusil, that is going to bring down the acidity which is given by HCl. So this is the concept. Hope everyone should be aware of this. Now coming to the contribution of Dr. Marshall. So what did he do? He is basically an Australian physician who obtained his medical graduation in Australia, but he was working in Royal Perth Hospital in Australia along with Dr. Robin Warren. Both were together working in a project related to ulcer. Until then, the continuous prolonged HCl was found to be the sole reason for ulcer. Now these two are giving a new concept that a bacteria can be responsible for ulcer. Now the bacterium will be referred as Helicobacterium pylori. In short form, we call it as H. pylori. Now when these results were conveyed to the scientific world, it was highly ridiculed. The reason was, until then the myth is increased HCl is going to be the sole reason for ulcer. Now they are giving a new concept. There is a bacteria responsible. How a bacteria can survive in a acidic medium there inside the stomach? Normally when we accidentally get exposed to acid, okay, our skin gets burnt. Okay, in that such a situation, how can a tiny bacteria can survive the acidic condition? Right? And if this is going to be the reason, then how can antacids can cure the ulcer? A lot of reasons made the co-scientists, co-doctors, co-physician to ridicule their finding. Dr. Marshall, in order to prove his finding, he consumed the H. pylori bacteria lying in his laboratory incubator, right? And slowly, weeks after this, he started getting symptoms for ulcer. Biopsy was done. Biopsy proved that he has got ulcer, and when he started taking antibiotics, slowly he got relieved of his symptoms. Okay, antibiotics are the one which kills the bacteria, so that it helps us from infection. Okay, so friends, Dr. Marshall, in order to prove his finding, he risked his life by consuming the bacteria, and he got ulcer on his own. Right? Not accidentally. He himself got the ulcer voluntarily to prove his theory. So this is the dedication, okay, of the scientist that we need to appreciate here. This results was further, it had further challenges but finally it has got published in Medical Journal of Australia, and it is one of the most cited research article that we have now. And these people were further awarded Nobel Prize in the year 2005. That is both Dr. Marshall as well as Dr. Warren. Both were awarded Nobel Prize in the year 2005 for this work. Okay, in the field of physiology or medicine, right? So this is the dedication that Dr. Marshall had towards the science. So that we get to know a bacteria can be a causative reason for a person to have ulcer, right? So if you have liked this video, kindly comment and do share and subscribe. Thank you.